Hi there, and welcome to the Shear Recovery Podcast. Shear Recovery is a drug and alcohol treatment center in Southern California. We treat for co-occurring disorders, and we're launching this podcast to bring free information to our audience about how to get help, what resources are available, whether it's new modalities in treatment or just different solutions for you. We're available on many platforms, whether it be Spotify, iHeart, YouTube. So check us out and listen in if this is something that you're interested in. Today we're highlighting adolescent care is centered around mental health as well, and we have Paradigm Treatment Center here located in Malibu. They also have locations in Northern California, around the Bay Area, San Francisco, I believe, as well. And without further ado, here's Paradigm. Would you mind introducing yourselves and your role with the company there?
Yeah, I'm Lucy Bramwell, LMFT Clinical Director of Paradigm.
Nice.
Hey, and I'm Dustin Wagner. I'm the Chief Operating Officer at Paradigm.
Nice.
Yeah.
Now, Paradigm, I know you've got multiple locations. I think you're headquartered mostly in Los Angeles, and you've got a lot of resources there, at least two programs for adolescent, which adolescent here means between what ages?
Between 12 and 18.
Between 12 and 18. So no one is younger than 12. And if you're seeing some issues, maybe you seek a doctor, but mental health related, especially in adolescence, is difficult. So between 12 and then up to 18. And then once I guess you turn 18, you'd be considered a young adult or in a different bracket from adolescence. You would keep them separate from a minor, right?
Right. And we have a young adult program, 18 to 26 in Malibu.
Okay. So for young men and women who don't maybe get it right at the first time, and when we start early, especially with adolescent, you hope to solve this problem before it becomes a bigger problem. But for those who maybe have a 17-year-old getting help when they turn 18, they can still look to Paradigm for continued care, and they don't just age out of the program, is what it sounds like, right?
Yeah, certainly. So we, average age is like that 15 to 17. Just because you're 18 doesn't mean that you have to go be with adults. We have a lot of 18-year-olds that are still in high school. So we like to keep those with other high school students. So there's not like a firm cutoff.
Right.
Yeah. But so, yeah, you're not like aging out of the system or anything like that.
Right.
Yeah.
Well, I know with health insurance now, does that cover this type of program?
It does. Yeah, it does.
Okay, that's good to know. I know for with Obamacare and some changes with health coverage now, if you're a dependent, you can be on your parents' or loved one's health plan until the age of 26, from what I understand. So it's good that there's solutions out there, especially with such a difficult disease, and some diagnoses are difficult, especially, differentiating. And maybe you can speak with this a little bit to this, Lucy. What about a parent who just says, gosh, my son or daughter has so much trouble? How do you distinguish behavior from mental health? Because I imagine they overlap a little bit.
Yeah, it's absolutely overlapped. We treat mental health, so depression, anxiety is most of what we see, and the trouble, like you're saying, is all tied into that. And our belief, and we tell the parents this, is that they've come not knowing how to deal with their emotional material, not knowing who they are, not having the resources to figure that out. And we want to help them unpack that with, insight-oriented work and getting them to be more aware of what they're sitting with.
The difficulty, I think, for many parents and for a lot of us maybe is out of sight, out of mind, or you don't want to say, gosh, my teenager is schizoaffective or has schizophrenia or bipolar or just anxiety, self-esteem issues. And so, in addiction recovery, you start to see the behaviors turn into an addiction. You see substance become prevalent. So that's an obvious one. If you're using heroin, methamphetamine, there's a lot going on. But for a parent who has a young person who's developing and they don't want to throw drugs at them, gosh, what's a behavior and what is mental health and how do I help? So I think I just imagine, as an outsider who doesn't treat specifically adolescents, you probably see a lot of that. And how do you help parents distinguish?
Yeah. So it's really helping them see that behaviors are a part of the mental health. Most teens come in irritable because they're depressed. Most teens come in irritable because they're anxious, and not knowing how to sit with that, not knowing how to cope through that, and so it's psychoeducating the parents. Yes, there are, some boundaries that you have to hold, and at the same time, compassion and helping to develop insight with the teen is what's going to help them. So and that's the way we approach it with the teens too. We want to build a relationship with them, want to get to know them outside of the behavior that they might be exhibiting, and see through to the really core issues of what's going on. And you're right, a lot of it is self-esteem, and a lot of it is, not knowing how to move through the social environment that teens typically move through, which is way harder nowadays than it has before,
especially with social media and bullying, and they've got it coming at all directions. And it's almost, for me, when I think about it, it's almost too much to ask of any one teen or adolescent to be totally equipped with these life skills. I mean, gosh, we could all use some therapy, right? And what an advantage if you look at it as, hey, I've got some issues in my life, I need help to be a better person. And to start at such a young age and instill things like discipline, boundaries. Gosh, when I learned about boundaries, I mean, my whole life changed for the better. And to be able to install that at a young age and help equip them is really helpful. And I imagine you probably see it with very well-equipped families that come from good family structure, and families that are broken or maybe don't have the structure.
And you bring up a good point, because we see, the typical kid and family that we treat, they've tried their best. So it's not like they're not ignoring things. It's, and as a parent, I think it's hard to tell how much of this is normal behavior, just like teenage stuff, and how much of this is, a manifestation of like, this is serious depression. This is general anxiety disorder. There's a trauma that we don't know about. And so I think what we try to help parents differentiate is, how bad is this? And usually that line is like, does it impact the day-to-day functioning? Does it make it hard for your teen or for your 20-year-old to function, to go to school, to go to work, to be social, to have a regular sleep schedule? And then, if behaviors are a manifestation of emotion, then that's when we start seeing like the different behaviors, like some of the, we see a little bit of everything. We deal with teens that are struggling with suicidal ideation and substance abuse and, lots of social media addiction. And so, like what Lucy's saying, so much of it is, we're just trying to educate parents, trying to educate teens, and that's what we specialize in.
Nice. Yeah, I think you really touched on something there with motivations. You've got families that they're being good parents. They want to help.
Absolutely.
And they're trying to find out, what do I do? And the trouble is, for most parents, they have a job or they have other things as well. And so you can't 24/7 watch, your son or your daughter or your loved one. And so that's when you really need to turn to a program that's 24/7 that can manage these things full time. And I think, like anything else, when it becomes a problem, it's a problem. And so you can deal with these things as a parent and support them and help them grow and come along. But as soon as you're failing out of school, or you're not attending classes, or you're not showing up here or there, and and especially with like depression and despondency and these things, it's scary, because if you can't motivate with external motivation by a parent with the carrot or the stick, or however you're trying to help your child along, with depression and some of the mental health issues, sometimes they just can't find their own internal motivation. Like, it just doesn't matter. So, these are things where I think parents find themselves wondering, like, gosh, I don't want to send my kid to rehab like it's a punishment, which it's not, but I want to help them. And so when because you guys help people from all over the country, you're one of the most established adolescent programs in the country. What are the typical calls, or is there anything you could say like, hey, once this occurs, a lot of people call, right?
You want to take that one?
Anything?
Yeah. I mean, once the daily living is hard to get to. And also we have a lot of kids coming from hospitals from a recent attempt, from really severe self-harm from an overdose, or engaging in really dangerous behaviors outside in the home, so that's when it gets really hard to manage, and rightfully so. I think what we want to help the teens do is look at their emotions from morning until evening, and give them the space to really explore that in a way that's safe. Sometimes being at home or trying outpatient is too much because they try to hold it all in, and then it becomes a crisis. So, we typically get the families that are in crisis, and whether or not that's a physical crisis, they're always an emotional crisis too.
Right. And there's a lot to talk about there. Now, when it comes to SI, suicidal ideation, suicidal thoughts, or even a suicidal attempt, do you guys have a stabilization program yourselves, or do you work with a higher level of care, like a hospital setting, until they're no longer suicidal and then they enter the program? Or, with mental health, it comes up, whether the thought or the action is prevalent in some cases. How do you guys deal with that?
Yeah, so we're a step down from the hospital. So the hospital's inpatient and are able to actively, physically keep them safe. And once the hospital deems that they're safe enough to be in a residential treatment center where it's 24-hour care and they're in line of sight and supervision at all times, then they come to us. So they get assessed within the first 24 hours. They have therapists from, AM to PM all the way up until 11 PM to really give them the space to work through their suicidal ideation. It's very common that we have active suicidal ideation as long as it doesn't get to the point of action.
Right.
Yeah.
Right. Plan and action.
Right.
Well, in their job, when they're here with us, the teens that come to us, whether it's from a hospital or from like an outpatient setting, and for different reasons, parents have decided, residential is, we can talk about why residential works, but why residential is needed. Like we want to see just how depressed you are. We want to see just how anxious. We want to know about the trauma. You're going to have these urges. So, that we don't want them to, the typical teen that we get, we just get these sweet, insightful kids that are really trying they've got their whole lives in front of them. But they can't see that, or they can't get over whatever this hurdle is. And so they learn to wear a mask all day. And they're, someone will ask, how are you doing today? It's like, I'm doing great. But like internally, they just feel terrible. And, whatever's going on, they've just kept it in. It's all stuffed down there. They've got it in a headlock. And so when they're here with us, it's like, we want to know about that. We want you to be authentic. Let's clue your parents in to just how you see yourself, how you're feeling, how you're struggling. And so we're not the program that's like, okay, you're really depressed, you're not feeling safe, let's get you back to the higher level of care. We work in that system, but we want to be able to, we want to limit all the different transitions from levels of care. We want to just have you, the minimum stay with us is 30 days. So we're not just this place where it's like, all right, get stable, go to your PHP, go to your IOP, all that stuff. It's like, you're here for 30 days at least. And let's really get into this work.
So you bring up a good point with outpatient, especially with adolescents. You got someone who's 17, maybe they're still in high school, they're failing out of school, but the parents don't want to take them out of school and put them in an inpatient program. Right. Just on the odd chance that they might succeed. We don't want to give up yet. But at the same time, we know, especially when drugs get mixed in and they're not attending classes, school's not going to happen anyway, at least not on this go around. Then you've got to stop and address the mental health and other aspects. And then outpatient, it sounds good. I can go to school, I can work from home, I can do the things I want to do and still have my life. But the problem is, even if you're going in somewhere 8 hours a day, 5 days a week, you're checking out at 3:00. Your mind's a million miles away from your recovery.
You're exhausted.
And you're focused on other things, or you've relapsed, or you're living in an idle mind. It is a devil's playground, where you're having these thoughts and you don't have someone to talk with, like a therapist, like yourself, Lucy, or your team. So, it's almost a shortcut to try it that way and fail, so you really know. But at the same time, outpatient it's just step 2 in care. It's a supportive care once you're stable. So it's wonderful that you guys offer all the levels of care, and you start at the residential, which is appropriate, where they have full 24-hour supervision, like you say, line of sight. They're always watched, they're always with staff. Now, is there an educational component as well? Like, what if I've got to take my young one out of school? He's not going to get a high school degree. How does that work?
Right. Yeah, we're short-term residential, and that's all we do. We're good at it. And part of that is the education. So 5 days a week, for high school students, we're doing school in the morning on site. The goal is, we get a lot of kids from the hospital, but we get a lot of kids from just an outpatient setting or from home, from, local or from across the nation. And we coordinate with that homeschool. So we don't want, like you were saying, we don't want to cause any harm where they come get treatment, but then they're not doing their education. And then when they discharge, they got to figure that all out, and they're behind in their schooling. So we have teachers, they do everything on site. We'll coordinate with the school, send that back, and either try to get the kids caught up, or at least let's not get too far behind so that we can really focus on your mental health.
The world's not going to stop spinning just because you go to treatment, right? And it sounds like you really help bring out the internal motivations. Is that something that you see, Lucy, as like, what's a difference maker? Where do you see the successful clients versus ones that maybe we know they're going to need more help in the future that aren't just going to be done in one treatment segment? Like, are there qualities and things that you find? Is it just a willingness to change, or what is the difference maker?
Yeah, willingness can start there, or we can help build it. And I think what a big motivating factor that we provide consistently is the group therapy. Having them see the reflection of themselves in each other, having them be witnessed in probably, the hardest emotions and the biggest traumas or the biggest shame that they hold is the internal motivation, because once they feel connected with each other, they start to see that it is worth putting down that mask, that it is worth communicating and asking for what you need, and it is worth, working through a really hard depression or really, really severe suicidal ideation so that they can continue feeling connected.
Gosh, that sounds like putting me on a spot in a group to try and talk about these things. How do you do that? Like, how do you reenact with somebody, like internal relationships with their parents, or how do you bring out these scenes in a group setting where, I guess people are willing to participate in? It just seems kind of daunting to me. Do you guys have a process, or how does that work?
Yeah, it is daunting, and I definitely tell all the kids that all the teens that it's hard work. And I think what they get to see with our rolling admissions is somebody towards the end of their treatment who have been able to work through that and are able to be their authentic selves, be vulnerable, and also feel hopeful, because their next step is to go home. So they see a role model, an example, and they're also not alone, that they're usually not the newest people, and they're practicing this together. One of the biggest assignments that we give them is, to tell everybody about where you are, where you're from, what you're working on, and your life story. And I think, as an adult, I think anybody would have a hard time with that, but because they've seen other kids really be courageous doing that, then they get to do that themselves too.
It's something they do. So we do individual therapy every day, and it's all individualized. And so they're doing individual therapy every day. Then they get to take that stuff that they're maybe unpacking with their therapist, and they get to take it to group. And that's when you kind of get to really challenge some of your distorted thinking, how you see yourself. You get this great feedback. And then the group work goes into the family work that we do. So we're doing family therapy every week and a family day, and we can talk more about that. But I think what's really nice, and something that Lucy was hinting at, is if I'm a teen and I'm walking in the door for the first time for residential treatment, I'm thinking worst case scenario. I'm thinking like, this is going to be like the hospital I was at. This is going to be like, the bullies in gym class. It's going to be, a bunch of people that don't understand me. And then they walk in and they see like, caring staff. They see other teens really similar to them, that like, okay, you think similar to how I think, or you have the same struggles, or we have that in common. We're like the program that, treats the bullied, where life is a lot, they're harder on themselves than anybody else. And so there's a little bit of like, when they're in that group, they're like, oh, I'm with my peers.
Right. We all have something in common. We're all struggling together. But at the same time, I look at recovery. Anytime someone makes a choice to enter treatment, they've made a decision to better themselves. especially when we talk about addicts or people that have issues that, like, oh, rehab's full of a bunch of addicts. Not really. It's full of a bunch of sober people that are trying to change their life, So you find yourself in this group of kind of a misfit family where you're in a group and you've got a female over here who's not my sister, but she might as well be because we're friends now. And you get a little bit of support where a lot of times, especially when you're struggling as a youngster, you don't have the greatest friends, and whoever you're hanging out with might not be the best people. Sometimes they are, and you're just withdrawn from them. So being able to connect, find common ground, not just with the clients that are there, the other adolescents, but also with staff, and having that. Do you guys have a 12-step component? Do you do any 12-step modality with mental health?
Yeah, we do. And it's, along the same lines of individualized treatment. If the 12-step model works, then we will use it with that client. If the SMART model works for recovery, then we'll use that with them. But because our ratio is so high and we have so many therapists on and people who have, their own backgrounds in mental health, we cater to what works for them. And
nice. You can really customize a treatment plan, especially if there's certain traumas. I hate to even think about sexual trauma and abuse as an adolescent, but we know this happens, and all these types of things. You've got to be able to speak to that individual and not just to a group per se, because everyone may not have had that same experience, although they've had their own, right? And I love that. I think anything, whether it be 12-step, SMART recovery, these are blueprints for recovery. Steps we should all take in our lives anyway. I mean, they're not bad steps. So having that, but I've also always seen it as a really good support system for somebody who maybe doesn't have those friends, when you can just plug in and find commonality. Hey, this is a group of people that are committed to not using substance or committed to following a certain path in life. How much, I know your mental health as a primary is really where you focus on the anxiety, depression, traumas, and these things. How much substance abuse do you see overlapping, or is it just marijuana? I mean, you start at, 12 is the beginning treatment phase. So what type of co-occurring issues do you see like that? Do you help those with co-occurring as well? Or?
Yeah, we do. Marijuana, you mentioned, it's definitely increased in the past few years.
Yeah. Vaping, man. Jeez, everybody's
easy access, and it's free. It's not free, but it's legal, so it's purchasable. I suppose you have to be 18, but that never stopped anyone with the motivation before. So you see a lot more marijuana use. I imagine the waxes are also more prevalent, which are much stronger in this generation than before. So it's common that I guess you would see some substance abuse when there's mental health in a teen. It's kind of goes with those behaviors. Another warning sign that, hey, this isn't just pot. This could be a deeper issue of anxiety or whatnot. They call it a gateway drug, but I wouldn't talk about marijuana as a gateway. It's just the first thing that you try that breaks the norm. Like, oh, this isn't going to kill me.
Well, what it does, I mean, if you're anxious, if you're depressed, and you've maybe actually kind of tried some other things, and it's just, it's so severe, it wasn't helping, that works great. I mean, to check out, to numb your feelings works great. But then after a while, it can take over. So, we get a lot of kids that, we have a lot of kids that have never used any substances, and that's not the path that they're on. And then we definitely get the kids that, like, I was on that path where I was doing my best, and this is what I've kind of turned to. And we don't necessarily have a lot of kids that, meet the classic criteria for addiction or dependence.
So young, right? It's hard to be dependent when your body heals so fast and so young.
Well, and they, they're the teens that are maybe using, they're not like out partying per se. They're in their room just like trying to get through the day.
So you'd see probably self-medication, right? Especially if you've got a bipolar who doesn't want to take their meds. It's probably kind of one of the things that, you enjoy the manic phase, you hate the down phase. So it's hard to take meds, but
there's maybe less of a stigma too. Like I don't want to go meet with my psychiatrist, but I'll just self-prescribe.
Right. And you hit on a good point. Alcohol, marijuana, substances, they're great for numbing us to pain and emotion. And they do great at covering things up, but it doesn't really solve anything.
It tends to get worse. I mean, the teens that we get, there's the things that they're they come in pretty attached to their phone, and then whatever they've been using, whether it's self-harm or marijuana, to cope. And then pretty soon, early on, you can kind of see that lift off whatever it is that they've been kind of turning to day in and day out. Like, the fog clears. The high school quarterback that is like, I actually hate football and I don't want to play anymore, but I've been doing that because I'm just trying to make the people around me happy. So we try to provide space, because I think what's going on is, for a lot of teens, they are just kind of thinking that they're doing what the people around them want. And that's not always the case, So.
Right. And we always think, at least I always think of an adult or a parent calling for their loved one, but you can call yourselves. It's very, the biggest step when you know that you're struggling is to call yourself and say, look, I've already identified that I'm stronger, better, smarter than this. I shouldn't be feeling this way. I don't want to feel this way. Maybe I don't know the path out, but you can call yourself and ask questions, and you guys have, counselors available for every state. I think just here in the U.S. mainly, but being able to speak directly to the individual is important, and customize these types of plans, because I think, uncovering the core issues is really a big, that's the whole thing. And you've only got 30 days. I imagine if you're 16 years old, you think 30 days is like a prison sentence,
Yeah, it feels like eternity.
But it's a blink of an eye. It's really not much time at all. But if you can really delve in and instill some things, how do you help? So you talk about the family dynamic. How do you help somebody in 30 days? I mean, what is beyond that? They've got to go back home. They're bringing that loved one is going back home at some point, especially if they're a minor. Like, how do you transition that?
Well, the family's heavily involved, and so minimum stay is 30 days. I'd say the average is like 45, 60. There's no like cutoff, but when someone discharges, they've done maybe say 6 months of outpatient therapy, kind of crammed into 30 days. Not crammed, but
it's 24/7.
It's fast tracked. Yeah, we're doing it every day. It's kind of on and off all day. So they've gotten in touch with their feelings. They've learned how to maybe manage it. They're not perfect. No one leaves fixed, but they've got a better feel for what's going on. They now know how to interact with their peers. What are my boundaries? How do I let people in? How do I maybe kind of shut that person out? What do I need? And then most importantly is, because that all builds towards the family work. So as a family, how do we connect? How do I get my dad to get closer to me? How do I maybe have my mom take a step back? What's my relationships like with my siblings? Like, that's all the work that we do. So when someone leaves, they have a better idea of what works for me, what doesn't work. And how do I clue the people that I love and care about me? How do I clue them into my life? And then from there, it's like riding a bike. It's like, all right, great, go home.
Now you see how to do it. So you pull them out of their situation, and you're saying it's helpful, like to not have mom and dad around at the time, so you can have some insight and think about yourself and understand, gosh, this is the dynamic with my parents, and I wish they would hear me better here or here. And then you can come back together once you process some things in therapy and understand your needs, goals, and wishes, and then had a chance to understand that, gosh, my parents love me. They're not upset with me. They don't hate me. They just know that I could be better, that they want to see me healthy, see me well. And so bridging that, and then hopefully having a chance where, a lot of these things probably take years and years, but if you can delve in with an adolescent in 30 days, 45 days, 60 days, it sounds like you can move mountains, or at least start that
the goal is
process.
Let's get back on track. And so the teen or the young adult's our client, but so are the parents. And so the parents get their own support, education. We're doing family therapy every week, at least once a week. We're doing a Saturday family day. They're getting their calls and their updates, and in that, those are therapeutic interventions that we're doing with parents, and we're providing them feedback, we're providing them education, support, redirection when that's needed.
When you talk about family therapy, and it sounds like whether you're local in the Los Angeles area or Northern California, like the Bay Area, you've got the ability to communicate, and have those on-site family things. Now, I'm sure you could fly in from out of state as well. But do you provide, how do you communicate with families that are out of state maybe? Can you do Skype, or is that the therapist on the phone? I imagine it's a little different than, maybe not all of them can be there, right?
Yeah. We offer video conferencing for those that aren't able to come in. We could do phone therapy too. And I think too, the kids and the parents can call in and out every single day.
Right.
And those are all really good opportunities for them to practice effectiveness skills, to really practice, what does a meaningful conversation look like? So alongside the video conferencing, we also have phone calls every day, and we don't really limit that because
I wonder about that. I know in adult treatment, like in our recovery center, there's some definite blackout periods and some periods of times where you don't have communication or don't have your cell phone, because we're trying to get you to focus on yourself and not talk with your wife or girlfriend or boyfriend or whoever may be triggering you or take you off of that path per se. So, it's a kind of a two-edged sword sometimes. Like, you got a 17-year-old who's in love with his girlfriend back home or boyfriend or whatever. I mean, gosh, they're checked out during that phone call. But at the same time, you want to, it's not a knife, it's not a weapon. You want them to like have a phone.
Right. So. I think the phone calls are all intentional. So young adults have a different like protocol around that, and the teens do too. Yeah. And for the most part, from 8 a.m. till 9 p.m., there are gaps in the day where the teen is able to talk to their parents, and we as therapists and staff are, supervising them and making sure that there is support after maybe a difficult phone call, and using that as an opportunity to make maybe the next phone call better.
That's a great point. It's like, hey, how the call doesn't seem like it went too well. You were just smiling. Now you're not, smile's gone. Like, what happened? And to be able to process that out with a licensed therapist and someone who's familiar with teens and have seen it all. And I think that's really, you guys bring so much competency with Dr. Nolan and your team over there. And you guys can find out more information, by the way, paradigmmalibu.com, I believe it is, to locate. That's their flagship is in Malibu, California, right near the beach in Southern California, and locations in the Bay. But all their staff is well trained and can help just answer Q&A. I imagine, you mentioned health insurance covers these types of things. There's educational requirements. There's not really, when you're a dependent, there's not a lot of reason. If you're not doing well, hey, I've got a place to stay. I've got food on the table. My educational needs are going to be met. And I imagine you guys can kind of scrub the insurance or look at that, make sure they have coverage before they come in. And gosh, I've seen insurance cover 100%. And then sometimes there's deductibles and things. But, people should look at this as a real solution and not a punishment,
Well, and that's what's great is, most teens are not going to elect to say like, I'd really want to not live at home for a while. I want to not see my friends or my girlfriend. But once they're with us, they see like, wow, someone just like me is 2 weeks in and he's telling me that he's made all this progress. And I'm walking into a program that the teens actually like it here. The food's great. We have fun too. It's not just like grueling therapy day in and day out. So the teens that we get, they enjoy it. Yeah. And that's when it kind of starts to connect where it's like, okay, what we hear a lot is like, I don't really want to be here, but I know that I need to be here, and I'm good with that.
Right. Yeah. There's a little bit of anxiety. First day of school, new place, new people. Sucks. Got to go away from home. There's all these rules. Right now, I don't have to listen to the rules at home, so it's kind of giving up a lot of freedoms here.
Yeah, they don't have their cell phone, so there's kind of a natural detox. Substance use or not, there's a natural detox of like some of the day-to-day stress. There's a detox maybe from the phone, from the maybe toxic relationships, and we kind of get to remove all of that, and they get to maybe reconnect with themselves for the first time in a long time.
Nice.
Yeah, and I think too, maybe something that stands out is a lot of clients and a lot of teens have great rapport with our staff. I think everybody on our staff cares. Everybody is so passionate about what it's like and how it's hard to be a teen and talking them through it. I think first and foremost, everybody is treated like a person. Every teen is seen for their resiliency and their individuality. And I think, it's not one size fits all. For Paradigm, it's about getting to know that person, getting to individualize that treatment plan, and also getting to know what they want in life too.
Right.
Yeah.
So that's the big picture, is getting to the bottom of it all, helping someone along, helping them understand that, hey, this isn't about 30 days or 45 days. It's about the next 30 years, the next 45 years. Are there things, so you mentioned one-on-one therapy, daily therapy, group therapy. Dustin mentioned you've got some activities. What are we missing? What does our audience want to know about? Like, what could they expect from a day of treatment other than some groups and seeing a therapist?
Yeah. I think we really try to emulate a holistic type of living, a well-balanced life. So we really incorporate a lot of fun, so art therapy is fun for some, and so is horseback and surfing for others. So we give them a lot of space to really explore what it's like to re-engage and what it's like to be interested in something again. And at the same time, we also have balanced meals. Our chefs are able to cook really balanced meals that's tasty for teens, which is a skill and a craft. I'm not sure how they do that, but they do. And with our therapy, yes, it's therapy, but also we could be shooting hoops and doing therapy. We could be doing a session on a walk. So, their daily living, it's, it includes the sleep time, it includes, the activities and all, I think everything.
And I get a lot of questions about in adult therapy about, well, why are we going to the beach? Why are we doing this? Like, especially if somebody is paying for somebody else. Like, hey, I'm paying for them to be in 12 hours of group every day, not to go paintballing or something. But I think it's important that our audience understands that recovery is a place to grow and heal. And for many of us, we don't do anything without substance or without these problems. So to be able to laugh, put a smile on your face, make connections, do something where you just feel normal again, and you make those connections and make friends is as big of a part of recovery as the therapy session is, right? So providing that place where, hey, I'm away from my family, my loved ones, my cousins, my brothers, and I'm going to rehab. This isn't a bad place. Like, I'm by the beach. I'm in California, whether it's Northern California, Southern California. I've got good people around me, caring staff, loved ones. I've got great food. I'm in a beautiful place. Like with most people, I think when they start to get better, they're like, whatever the price, it's worth it, because I feel this way today and I'm in control again. So that's huge that you guys have been able to provide that help to so many.
The other thing too is, so everything we're doing is relational. It's, from a therapeutic approach, but we also have these amazing medical teams. So our psychiatrists in Malibu and in Marin County, and our nursing staff, that's a major component of all this too. We have a lot of kids that are not on medication, maybe don't need medication, but we have a lot of kids that are coming in on medication or would really benefit from that. So it's not just, throwing medication to calm down the symptoms, but if you can find the right dose, and that's what's great about residential is like, we're monitoring, we're always assessing, whether that's from a medical perspective or psychological. We just want to make sure that what we're doing and what you're leaving with is right. And so I think that's really invaluable.
Yeah, definitely. And especially when you talk about the mental health component, medication management is a huge thing, to be balanced. And for some people, it's very effective. And there's non-narcotics. You don't need Xanax for anxiety. Okay. I mean,
No.
there may be a place for it for the right person or whatever, but they call it a chill pill for a reason. It's not a daily use thing. It's not for sleep. It's a powerful narcotic, and there's a lot of powerful drugs. So having a skilled psychiatrist or psychologist that can understand the bigger picture, especially when you're dealing with a young adult or someone who's not even an adult yet, 14, 15.
Yeah, their brains are still developing. And so that's what's great. Our psychiatrists are child and adolescent psychiatrists. So they are not going to, do heavy, they're not doing the heavy stuff. It's like, let's see if we can tweak this. Let's it's really kind of a conservative approach.
And then they get to follow up with them and monitor them while they're in treatment. So if changes need to be made or whatnot, hopefully by the time they've discharged, they're stable, they've reached homeostasis where they don't have these cravings and urges, they have a general feeling of wellness. And then from there, it's a foundation to build on, right? As hopefully they've continued on their education, they're back on track and then ready to reintegrate with family and get back to the rest of their life, right?
Yeah.
That's the plan. Yeah.
It's so cool. It's so impactful that you guys can deal with young adults. It's such a, gosh, I still remember teachers from when I was a kid that made an impact just by being cool people. And I feel like we all look for those relationships. So to have that, you know, at a young age, it is really great. You know, adolescent mental health is difficult enough, and then you make it an under the age of 18 person, and it seems overly complicated. So we're all really glad to hear about Paradigm and the successes that you've had over the years and your clinical experience with Dr. Nolan. I mean, gosh, how long has he been practicing for now?
Yeah, Dr. Nalen, he's been, him and Cole Rucker, 20 years. Those are, the founders of Paradigm. But yeah, since then, we now have, we have 5 programs in Malibu and 2 in Marin. So it's really grown.
Okay. So you really handled the Orange County, the Southern California. How many of your clients would you say come from out of state?
Yeah, it's probably closer to 60, 65, 70%.
There just doesn't seem to be a lot of help out there. I mean, the Southern California area, and now you're in the Northern California area as well, is really blessed because it's a niche. I mean, we have calls all the time for adults that struggle with this or that, mental health or substance abuse. When it's an adolescent, I mean, there's a handful. I can think of 4 off the top of my head and that's in Southern California. It's a big area. So I can't imagine if you're in Texas or Mississippi or spread out through the country, you have even less opportunity to find, solutions. So
yeah, if you're a teen or a young adult, 12 to 24, 26, and you're struggling with some complex mental health issues and some circumstances that you've been through, it's a really hard system to navigate. It's a really hard system and to find the right fit. And so that's our mission.
Nice. I want to put that phone number out there for you guys. Again, it's 855-472-8929. And that's paradigmmalibu.com. So 855-472-8929. They're available 24/7. You can call with questions or concerns. It's not a commitment to enter treatment. It's just to find it. This is right for you and your family. And if they can provide some solutions, really good team. Shear Recovery would not highlight or back anyone we didn't fully trust and understand that, hey, these guys are doing it at a high level and they're operating in a way that can help others. So we really wanted to take that time just to highlight you guys and the work you've done nationwide in a really tough, what I consider tough segment, with adolescent mental health, substance abuse, all rolled into one. We're all really grateful to have you guys out there. Are there things, Lucy or Dustin, maybe about your program, things that we didn't talk about today, or?
No, I think other than, my passion for this is really stemming from a place of, that we're not a one size fits all. We're not behavioral based. We really just want to get to know them and give them the space to explore what it's like to be an adolescent trying to find themselves. That's, already hard alongside the mental health component.
Well, you just opened the door now, because now I want to know what made you do this. Okay. What made you say, hey, I want to go help young adults and adolescents in this field, because it's very difficult. Now, you don't have to answer the question you don't want to. It's a personal question, but you've been you've worked your way up at Paradigm. You've been there 5 years or so, and you're a licensed LMFT with a master's. So why, with all that education and ability, you chose this group?
Yeah, I think maybe coming from, my own want of knowing that connection heals and being able to work in a place where that's across the board something that we really believe in and see that works. I think fostering connection with yourself, between the teens, with each other, and also from staff to teen is at the crux of so much of it. And I just think Paradigm does it well.
Nice.
Yeah.
Well, they've got you at the clinical director, so that's helpful.
Yeah.
I'll let Dustin off easy. I'm sure he's got a
Appreciate that.
long story too. But thank you again so much for coming in to highlight mental health and adolescence and substance abuse at Paradigm and what solutions you offer. That's a huge help to our audience. This is a Shear Recovery podcast. I'm Anthony Valanos, coming to you on iHeart, Spotify, and YouTube. Check us out, subscribe. If you really like us, you can hit the notifications. Otherwise, we'll just show up in your feed. And this is the Recovery Channel, Paradigm Malibu. Would you guys like to leave your contact and what you do, et cetera?
Sure. I'm Lucy Bramwell. I'm the clinical director at Paradigm.
Nice.
And Dustin Wagner, the chief operating officer.
Excellent. And that's paradigmmalibu.com at 855-472-8929. Call anytime. This is Shear Recovery signing off. Thanks for tuning in.